Hey guys! I'm going to be talking about medical assessment today, which is one of the 6 stations on your state exam. I'm just going to give a brief overview of what is required for each of the steps. So to start the station, your examiner is going to read you off a brief prompt. It's going to sound something like, you are called to the scene for a 50-year-old male having chest pains. You will first ask, is my scene safe? And the examiner will say yes. Then you will say, me and my partner are wearing the appropriate PPE. Next, you will ask, once I arrive on scene, what is my general impression? And the examiner will tell you some more information about your scene, such as when you arrive on scene, you find your patient sitting on their couch in their living room or something like that. Next, you will determine the nature of illness of your patient using information that has been told to you both in your general impression and also in the initial call. So, for example, this patient, I would say the nature of illness is chest pain. Then you will ask, is this my only patient? And for the state exam, the answer to that will always be yes, this is your only patient. Then you will consider the need for additional resources. It might be useful to call police or fire. Potentially, if you have a large crowd, you're in a dangerous place like the side of a highway, maybe there is a fire, or maybe you just need some help lifting and moving a heavier patient. Next, determine the level of responsiveness of your patient using AVPU. A good question to ask would be, I will now approach my patient. Are they alert to my presence? The examiner will then tell you yes or no to that question, and then you can continue evaluating AVPU if you need to. Most patients that you have for the medical assessment state exam will be both responsive and speaking to you. So continuing ABC, we're going to assess airway patency. Since the patient is speaking to us, we can simply state, my patient is speaking to me, therefore I know their airway is patent. I'm going to consider the need for an adjunct, and I'm not going to use one at this time. It's very important that you state that you're considering an adjunct and that you're not going to use one. Next, you will assess the breathing rate, rhythm, and quality of the patient. The examiner will give you that information. Then you must decide if it's appropriate to place your patient on oxygen. If their breathing is abnormal, it may be appropriate to administer a nasal cannula, a non-rebreather, or potentially even ventilate the patient. Next, you should assess the circulation, rate, rhythm, and quality. The examiner will give you that information after you've felt the radial pulse of the patient. Then you will ask, what is the skin color, temperature, and condition? This is one place where you may have to reassess your oxygen therapy decision. Patients may be breathing normally, yet have a skin temperature, color, and condition of pale, cool, and diaphoretic, which indicates shock, in which case a non-rebreather would be indicated. Next, you should assess for disability. The purpose of this step is to check if the patient has any abnormalities that are different from their baseline. So you could ask questions like, does the patient have any neurological symptoms? Or does the patient have any trouble moving any of their 4 limbs? If the answer is no to that question, then you can move on. If the answer is yes, then you should consider doing a stroke exam. For step 13, you do not need to perform a stroke exam unless you have reason to suspect that the patient may be having a stroke. Then you will determine the need for an ALS intercept. You need to make a decision if the patient needs higher level of care than you are able to provide. Next, you will verbalize the transport priority and the appropriate destination of your patient. You need to decide how critical they are, how quickly they need to be taken to the hospital. You have 10 minutes to make this decision. Moving on, you will now obtain sample history and OPQRS-TU. Make sure to ask each question individually, and don't skip questions just because they might not be particularly relevant for the patient. For example, for a patient that's not having any pain, asking for radiation of pain doesn't make a lot of sense. Instead, you could say, I've confirmed that my patient is not having any pain, so asking for radiation is not relevant, so I will move on. That way, the examiner knows that you're not just skipping over the question and will still give you full credit, even if it doesn't apply. Next, you will need to perform a focused physical assessment on your patient. This step is important for discovering information that you have not yet revealed throughout your other assessments. It can be used to look for physical signs and symptoms, such as urticaria, swelling, exposing the skin, looking for trauma. It's also a good place to ask any questions that you haven't had a chance to ask yet, such as when was your last period? Is there a chance you could be pregnant? Is there a chance you were stung by a bee? And other questions that you might have for the patient that are applicable to the symptoms that they're having. Then you will obtain their baseline vital signs. Make sure to ask every single vital sign one at a time so that the examiner has a chance to respond to each one individually. And make sure you're not missing any of them. This is important to get full points. Then you will move on to verbalizing the appropriate medication options. At this point in the assessment, you should have already come up with an idea of what you think is going wrong with the patient. And you should have an idea of if there are any medications that you can administer to the patient that would be helpful. Sometimes there are no medications that you can give. At this point, you must simply state, there are no interventions that I can give to the patient at this time, and then move on to step 24. However, if there is a medication that you can administer, name it here. Then move down to step 21 and assess the relevant contraindications for that medication that you're planning on giving. For example, for a patient with low blood glucose, I might want to administer oral glucose to that patient. I know one of the contraindications for oral glucose is if my patient is not capable of swallowing on their own. So I will ask the examiner, is my patient capable of swallowing on their own? If the examiner says yes, I will continue to the 6 rights for oral glucose. If the examiner says no, I will say it is not safe for me to administer that medication and either choose to administer a different medication or simply say there is no other intervention I can give and move on down to step 24. If I continue moving forward with the medication that I want to give to the patient, I will identify the 6 rights for that medication, or if I'm administering multiple medications, I can give the 6 rights individually for both medications. Finally, step 23 is just the statement, I will now administer this medication. This step simply checkmarks off the fact that in a real-life situation, you would have now given that medication to the patient, and there's no way that you can take that back. After I've administered a medication to the patient, I now need to reassess that patient. So I will say, after 5 minutes, I would like to reassess my patient. This is a place where you need to start asking some specific questions. What exactly would you like to reassess about this patient? What changes are you expecting to see that medication to have enacted? So, for example, I might ask for specific vital signs like blood pressure, heart rate, respiratory rate. I may ask, what is the patient's pain level now? Has the swelling gone down? Things like that. Some medications, like epinephrine, allow for redosing. If the first dose doesn't work, you're allowed to give a second one. So this would be a place where you would then go through the 6 rights again for that medication and give the second dose if indicated. If not, you can move on to step 24, where you say, I will now continue to transport the patient to the nearest appropriate facility and reassess their condition, my interventions, their vital signs, and my transport decision every 5 minutes for critical patients. At this point, you come to the end of your scenario. You must complete the entire scenario in 15 minutes to pass the station. If you look to the bottom of the sheet, you will also see a list of critical criteria, and if you meet any of these critical fails, unfortunately, the entire station will be failed, and you must retake this assessment. We will have many opportunities to practice medical assessment in class, as well as answer any questions that you may have. Thank you for listening.